Over 100 patients have been sent to Malaysia and Singapore for medical treatment in the last 6 months, and many more are still on the waiting list. Most of the patients sent abroad or awaiting transfer need urgent treatment for cancer, heart surgery, and neurosurgery, treatments currently unavailable in Timor-Leste. Every year, the government spends millions of dollars to fund these medical treatments, funds that critics argue could be invested in upgrading domestic healthcare facilities.
4 months, the family waited, holding on to hope as they watched their son endure, praying for the treatment he desperately needed. On Friday, Marilu Souza dos Santos Lai finally moved to Malaysia for medical treatment.
He left with a serious health condition. We hope his treatment goes well and he can recover soon and return in a good condition.
Last year, the family noticed that Marilu's neck was swelling and immediately took him to several private clinics in Delhi, including the National Hospital for Medical Care. However, it took months for him to be diagnosed with a cancer called Hodgkin's lymphoma, and the necessary treatment was not available at the National Hospital.
We as family brought him here every week for checkup in April 2026. I myself took him here to see doctors, and they informed us that he needed to be admitted for further treatment and be diagnosed. After he was admitted, the doctor did several tests, such as blood tests and X-ray. He was diagnosed with tumor cancer, and the doctors told us that they will send him overseas for treatment because of a lack of equipment and medication here.
Prior to his departure for Malaysia, Marilu was admitted as an inpatient at the National Hospital for 2 weeks.
We can say that his daily consumption is paracetamol and injections to stop the bleeding from the nose. The bleeding came out not for a minute, but for an hour and a half.
Battling a devastating illness, a 13-year-old Marilu was forced to walk away from his dreams, leaving his studies behind to fight for his life in Prince Court Medical Center, Malaysia. Marilu's story is far from unique. Over 100 patients currently remain on waiting lists for treatment abroad.
The list comes from the medical board, totaling more than 350 patients requiring overseas treatment, and 208 have been approved, but some hospitals have not given confirmation about when the patients will leave.
The government has an agreement with 3 hospitals in Malaysia and 1 in Singapore to provide medical care for patients requiring specialized care unavailable domestically. In the 2026 budget, the government allocated $19 million to pay for treatment and the government that for overseas treatment.
Sometimes the hospitals send us invoices. If we are late in paying, they add interest to the amount, which impacts our budget and causes that we pay the initial amount, but they apply interest.
In July, Prime Minister Sanana Gusmao revealed that the government had accumulated a $38 million debt to fund medical treatments abroad. Ultimately, the struggles of Marilu and so many others highlight a desperate desire for specialized care closer to home. Paulina Quintaun, Jerry Madeira, RTTL World News.